Hello, good morning, good afternoon, good evening, and a big warm welcome to C3 Collaborating for Health and our international seminar in partnership with Global Health Partnerships. And we are delighted to see you all and a few people still joining, and then we will start. And it's my great pleasure to introduce Alison Cox, who doesn't feel like an international speaker to those of us in the UK, but she is in Geneva, which is probably beginning to look very beautiful around the snowy winter. But most of all comes with the knowledge of the UN summit, which feels almost a long while ago. And Alison will be able to not only talk about it, but also going forward. We please do engage on the chat. We hope there'll be time for some questions and discussions afterwards. We will be recording, and over to you, Alison, to lead us through the complex world of UN summits.
Oh, well, thanks very much, Christine. It's my pleasure to be here. I used to enjoy, when I lived in London, coming to C3 breakfast briefings in person before the pandemic. So it's a great pleasure to be with you all online this morning from actually a grey and dank Geneva.
Oh.
I'm going to try to share my screen, if you bear with me. And I'm going to do my best to answer the exam question that has been set to me. So I hope, can you all see my screen and not my notes?
We can see we can see your screen and no scribbling notes on the side.
Great. Okay, so I shall try and look polished and not like I'm reading. So yeah, this was the question I've been set. I'm going to do my best to work that through over the next half an hour or so and leave enough time for some questions. I'm going to use a sort of standard storytelling technique, which is I'm going to start with a moment of drama, some breaking news, and then go back and tell you the story of how we got here, and then a little bit of what happens next. So last night, and so the timing of this webinar could not be better. Last night at the UN General Assembly, it finally adopted a resolution adopting the political declaration that came out of the UN high-level meeting that happened on the 25th of September on NCDs and mental health. It was a vast majority in favour and just the US and Argentina voting against. And as I say, it was a moment of some drama. And in this presentation, I'm going to hope to tell you how we got there and why it matters. But firstly, let me just quickly present our credentials about who the Noncommunicable Disease Alliance are, the NCD Alliance. We're a global civil society organisation, and we're dedicated to a world free from the preventable suffering, stigma, disability and death caused by NCDs. We're a membership organisation who now have over 500 members from around over 100 countries, and that includes more than 70 national and regional NCD alliances. We're also in official relations with the WHO, and we co-chair the WHO's NCD Civil Society Working Group. Our mission is to unite civil society to drive action on NCD prevention and care, leaving no one behind. And our strategic goals align with the globally adopted targets, of which more later. And we focus on 4 impact goals of prevention, care, financing, and community engagement. And what drives the Alliance, like C3, is a response to this global health tsunami of 41 million deaths per year due to NCDs, such as cancer, heart disease, diabetes, and lung disease, which is over 74% of deaths. And the fact that these are not just diseases of old rich people in high-income countries. Over 14 million people die between the ages of 30 to 69, and 86% of those deaths occur in low and middle-income countries. The common solutions bind us together, both in terms of prevention through action on the common modifiable risk factors of tobacco, alcohol, unhealthy diet, physical activity, and air pollution, and also action on better care for improved access to diagnostics and essential medicines, improved data, health system strengthening, and of course, the increased investment that's needed. And what also binds us is putting people living with NCDs at the heart of all we do. The NCDA Charter sets the agenda by defining principles of meaningful engagement and core strategies to ensure that people living with NCDs can have a role in setting and delivering policies, programmes and services. And indeed, the WHO launched its own framework, which has a great deal of congruity with ours and very much in line with our Charter. We also run our NCD Diary storytelling project with people living with NCDs sharing real-life accounts on specific themes, and through the Our Views, Our Voices initiative that provides support to people living with NCDs on becoming effective advocates and spokespeople. So that's who we are. And now to sort of go back to this story and try and answer this question about why NCDs wanted to have a health summit and has it helped? So I'm going to start with the NCD Alliance origin story, which goes something like this. NCDs were not included in the Millennium Development Goals at the start of the millennium. In fact, they were very specifically excluded as the goals sought to focus on the challenges faced by the lowest income countries. And as a result, NCDs were not integrated into the various vertical programs which were set up to deliver on the MDG priorities like infectious diseases and maternal and child health. So despite accounting for these 74% of death worldwide, including that significant burden in LMICs, they received less than 2% of development aid for health. We were very much seen as the Cinderella of global health. So in 2009, the four big disease federations of UICC for Cancer, International Diabetes Federation, World Heart Federation, and the Union for Lung Disease and Tuberculosis came together and led a successful campaign to fix this. Well, obviously that's our story, but in fact, we also recognise that there's a role played by a number of other key players, including a much broader civil society coalition, certainly the NCD department at WHO under Ala Alwyn at the time, and Richard Horton at the Lancet, amongst various others. But also specifically a group of champion governments from the Caribbean community, CARICOM, who predated and inspired the NCD Alliance with the 2007 Port of Spain declaration called Uniting to Stop the Epidemic of Chronic NCDs, that recognise the devastating burden and consequences of NCDs on their citizens and the need to respond. And of course, a key person in this was the former director of PAHO, Sir George Arlane, who has been key in this process and has continued his leadership throughout. At the NCD Alliance, and I was around at the time, I was working for the Framework Convention Alliance, who worked in cooperation with the NCD Alliance, but being close involved in many of those discussions, it's clear that the NCD Alliance saw that what was needed for the NCDs was to get included in the next iteration of the development goals, what became the post-2015 agenda. And to achieve that, and to quote Eddie Cochran, what we needed to do is we had to take our problem to the United Nations. We had to go from Geneva and health ministers meeting in the World Health Assembly and take it to where heads of government met in the UN in New York. And the first step towards this was seen to be securing a UN Health Summit or a high-level meeting on NCDs. And back then, around 2009 and along then, the only health summits held in the UN in New York previously had been on HIV/AIDS back in 2001, and then an update meeting in 2006. And it was felt generally that this had been a watershed moment, having this health summit on HIV/AIDS in New York, and that had played a significant part in all the funding and programs that followed. And so the NCD Alliance and its allies drove a campaign of mobilisation at national and global level to demand action on NCDs and show that NCDs were a critical problem that needed to be addressed at the highest political level. Along the way, two key reports played a really important part in advocating for strong outcomes for that first high-level summit. The first, and by comparison, looking at the success in other health sectors covered by the Millennium Development Goals, it was thought what was needed for NCDs was to have better data on costing the problem and the proposed solutions to build an investment case. And the first of these on the cost of the problem were figures produced by Harvard and the World Economic Forum. And this said that the cost of no action on NCDs between 2011 and 2030 would be $47 trillion. And at the time, I remember conversations going on about whether this number was so astronomical it was unhelpful. I think more often we see this derived figure of $2 trillion per year is used, derived from this report. And the second from WHO and again WEF identified the solution. And that was a whole suite of cost-effective and effective measures with good evidence already that were available and that could be adopted at low cost and would reduce the disease burden significantly. So we had a cost of the problem and a way forward in terms of solutions. And I'm going to skip over this a little bit, but basically the campaign was a success. We got the resolution to hold a high-level meeting. We went through the whole process of trying to shape that modalities resolution for that high-level meeting and the negotiation of the outcome document. So the first high-level meeting was held in 2011. And the headline outcome that came from this was a goal of a 25% reduction in NCD's premature mortalities and by that we meant in the range of 30 to 70. And this was known as the 25 by 25 target. So we had our global goal. And this was swiftly adopted through the World Health Assembly process as well, along with a monitoring framework of 9 voluntary targets and 25 indicators. And this, in turn, provided the reference commitment that could then be used as a foundation to build the case for the inclusion of NCDs in the successors to the Millennium Goals through the Rio plus 20 Earth Summit in 2012, whose outcome document, The Future We Want, was seen to be the foundation document for the negotiation of what became the Sustainable Development Goals, the SDGs that were adopted in 2015. And certainly that Rio plus 20 document contains several specific mentions of global chronic disease epidemics, and was seen at the time to have shifted NCDs from global health policy agenda onto that global development and political agenda. And eventually that was adopted in the UN in 2015. And it represents a far broader agenda of targets for sustainability for all governments, not just the lowest income countries. And the goals for health were combined into the one goal, the SDG 3. And there we had it. With this came the goal we were looking for, this target 3.4, specifically addressing reduction in mortalities from NCDs, stretched to 2030. So reduction by a third by 2030, the 30 by 30 target, along with promotion of mental health and well-being. So you can say, what we'd set out to do, getting ourselves incorporated into the broader development agenda had been achieved, and Cinderella had finally gone to the ball. So what came next, having done this? Having got these political commitments and targets set by government leaders in the UN in New York, what came after that? Well, one of the main things we saw was it put in chain this technical policy development to inform and support the achievement of these targets by the member states and governments and other stakeholders. And for this, this mostly, because it's a health issue, mostly sat with the WHO as mandated by the member states of the World Health Assembly in Geneva. So I'll quickly talk through some of the things that came after this. Well, not only we firstly got a global action plan for the prevention and control of NCDs that set out to provide a roadmap with a set of policy options. This was endorsed with an updatable Appendix 3 that gave us a menu of policy options which were considered affordable, cost-effective and evidence-based, very much the successor to that 2011 report. And this Appendix 3 has been updated in 2017 and 2023 and become generally known as the best buys and other recommended interventions. And there's this ongoing commitment to continue updating this. Including stretching it as the scope of the NCD agenda has grown to the 5x5, including air pollution interventions, for example, should soon be added. There's also best buys. There were also technical packages and other action plans to address the specific diseases, such as the Global Diabetes Compact and the HART package, and the WHO PEN package for interventions in primary healthcare, and later NCDI's PEN Plus package for hospital care in the lowest income settings. For tobacco, of course, the FCTC, the Framework Convention on Tobacco Control, predates the whole NCD process, but is incorporated within the declaration commitments. And we've just had the 11th session of the Conference of the Party here in Geneva, along with the 4th session of their meeting of the parties to their illicit trade protocols. But in addition, WHO has sought to promote a package of key measures across the different risk factors, including the Empower package for tobacco control, but a range of others for physical activity, salt reduction, trans fatty acids, and other unhealthy diet issues. So a huge range of packages there. And these have been pulled together into an investment case, originally in 2018, but updated in 2021 and 2025, this saving lives, spending less. This is the report that's speaking to the wallet for government, making the case that best buys, again, are affordable and every country can contribute to and gain social and economic benefits. With this very important return on investments of $7 for every dollar spent, and significant contribution in terms of lives saved between 2011 and 2030 of 12 million lives saved, forecast, and preventing, for example, up to 28 million heart attacks and strokes, and generating over $1 trillion in economic benefits. So really making those big cases. So the exam question is, did all this help the rise in chronic disease? So let's take a look at what happened in terms of actual outcomes from all these outputs. So this year, the Lancet NCD Countdown 2030 produced its latest report. This is an analysis led by researchers at Imperial College London and a combination of funders, and NCDA is one of the partners in this process. And they've been looking across a range of data to try and give us the latest insights. So against that, those big targets, that 25 by 25 or 30 by 30 target of reductions in death. So yeah, what are the headlines there? So in most countries, reductions in death from, for example, cardiovascular disease. Oh, sorry, let me go again. The death rates from diseases such as cancer, heart disease, and stroke declined in 4 out of 5 countries in the decade leading up to the COVID pandemic. So 2011 to 2019 period. But the progress has actually slowed compared with the previous decade. So progress has actually slowed post the 2011 high-level meeting rather than preceding. But however, it does continue to decline. And in almost 2/3 of the countries, the rate of decline in chronic disease was slower. But looking at that, there's a real difference between what's happening across the different diseases. Reductions in death from CVD, including heart attacks and strokes, were the greatest contributors to declining chronic disease mortality. but also reductions in death from a range of cancers like stomach, colorectal, cervical, breast, lung, and prostate also contributed significantly. But on the other hand, increases in deaths from dementia and neuropsychiatric conditions, including alcohol use disorders, and some of the cancers like pancreatic and liver have counteracted those gains, sort of slowed that overall increase. And the authors offer caution that while the recent worldwide decline in mortality from these conditions is a success story, that slowdown shows an urgent need to further roll out policies and healthcare guidelines and programs. So yeah, and prevention is important, but we also need action on the delivery of healthcare. Let me keep going. Oh yeah, and similarly, specific to these targets, only 35 countries for women are seen to be on target for the SDG target 3.4, that 30 by 30 target, and 30 countries for men. Most of the more than half of the countries are likely to miss the SDG target, and in fact, mortality stagnated or increased since 2010 among women in 15 countries and among men in 24. So these are really concerning figures. There's also been a UN Secretary General's progress report that looked at disease, but also at progress in terms of policy commitments and policy program process in terms of delivery from WHO and by countries. And that came out at the end of last year, and it was based on a WHO Director General progress report. And again, this reflects that only 19 out of 94 countries are on track for the SDG target. And again, that progress has slowed since 2015. But on the upside, there is clear evidence that more than 100 countries have made progress on specific indicators since 2022. And it's worth looking at the progress monitor that's produced for NCDs, which gives us this more detailed look country by country on the progress countries are making. So, for example, one of the strong areas of progress is integration of NCDs into national plans, where 87% of countries included NCDs in their national health plans, and 76% of them included them as part of their national development agenda. So this integration piece is coming through. What we're still waiting to see, as I say, is this sort of need for increased progress, increased momentum in terms of health outcomes. And in terms of financing, I said one of the big challenges was less than 2% of development assistance for health. I know this is a bit of a psychedelic diagram, but if you look at this shows blocks of funding by percentage of overall development assistance for health. That pink line across the middle, is that what is for NCDs? Yes, it's grown slightly, over 3% in the most recent figures. So up on 2%, but still very much a minority amount of funding for NCDs and that global development assistance for health. So for us, for NCD Alliance, looking at all of these reports and all these outcomes, our overall message going into the high-level meeting that happened this year was it illustrated an implementation deficit and a lack of progress. We'd had a great deal of policy success, policy development, but really this implementation deficit. And since the last high-level meeting, which was 7 years ago, in 2018, a great deal of challenge has changed. The pandemic, the economic crisis that followed it, the escalating climate crisis, geopolitical conflict, and people living with NCDs are at the heart of the human suffering of this, what the World Bank calls a polycrisis. So we really wanted to make that key message as well. So it would seem overall, through all of that, the first summit had served to put NCDs on the global agenda and catalyse a great deal of policy development and technical support. And rolling into the fourth high-level meeting in 2025, I'm going to lay out now what we hope to get out of that and what we got. It's worth saying that UN summits on health are no longer the rarity they were in 2011. And in fact, in 2023, there were 3 in 1 week in New York, and there's some talk of some health summits, lots of interest in the health summits. So some challenge there, but we still felt it was a really golden political opportunity to engage. And that's because these are still the opportunities for a global multilateral process, taking it from the technical in Geneva and putting it back on the political agenda in New York. It's a process, and for us, the process is as important as the outcome. It's putting NCDs in that political spotlight for 12 months, and that gives us a real opportunity to engage, to focus attention, get some reiteration of commitments, review that progress and make that case for the need for accelerated progress and agree a way forwards. And really try and galvanise some consensus on international cooperation and on national commitments. And specifically, as I say, we wanted to talk about this implementation deficit and being off track, the need for updated global NCD targets. And we were seeing as a stepping stone towards putting NCDs on the agenda in the post-sustainable development goal era and linking them with the broader global health development agenda. So we wanted to see a strong political declaration, use this opportunity of what we sometimes called a Jubilee year for, raising the noise, making the case, getting some high-level political engagement with governments, both globally, but also importantly at the national level, using this as an opportunity to leverage that engagement with governments. We went through a policy development process and consultation for the run into the high-level meeting, and developed our 5 global outcomes that would help us progress these 4 impact goals. And we based these and they aligned with the WHO's NCD Global Compact that was launched in 2022, which was a post-COVID attempt to maintain momentum. So our priorities were grouped under these main headings, which we felt, all of our alliance members could use, of the need for accelerated implementation. For that, we needed mobilised investment. We needed what we call breaking down the silos. This is alignment and integration with broader health issues and broader development programmes, greater accountability. And of course, across all of this, first, last, and everything for us is engaging communities throughout. Oh, sorry. Keep going. So on the road to the high-level meeting itself, how did that work out? Well, first of all, it was a long road. It started in 2023 with the small island developing states, holding a technical and then a ministerial meeting in Barbados that produced a negotiated text of the Bridgetown Declaration, which really sort of was the first opening salvo and a setting of the agenda. There was a series of meetings on NCDs in humanitarian settings that led to one hosted by Denmark in Copenhagen in early 2024. Notably, the World Bank joined the World Health Organization in hosting what was the second financing dialogue for NCDs and mental health mid-year last year. And there were also, not mentioned here, global conferences on oral health and on air pollution that also were framed as preparatory meetings. And each of these were a real opportunity to engage governments on a range of NCD topics, both towards the high-level meeting, but also, as I say, for engaging for national action. In 2024, there was also WHO led a regional consultation process and developed the Director General's report that in turn provided the content of that Secretary General's report. There was the appointment of the co-facilitators and then the negotiation of a modalities resolution, set the scope and process for the high-level meeting itself, and a multi-stakeholder hearing in New York. And I just, briefly, this multi-stakeholder hearing in New York was particularly important for bringing civil society to New York. This was our meeting. The meeting in September was a meeting of heads of government. This was a meeting for a wider group, but brought into the UN to give their contribution of what they wanted to see coming out of this high-level meeting. And we really used that as an opportunity NCDA brought over 30 advocates from over 24 organisations to the meeting, and plus, other groups, particularly United for Global Mental Health, also brought a great deal of their members to New York. We had workshops. We ensured that our advocates had meetings with their missions in New York to build that relationships. And during the hearing itself, we had many speakers, both in terms of the plenary, the panel sessions, and speakers from the floor, noting and aligning with the NCD Alliance's call to lead. So we were showing we were all together and united in what we wanted to see come out of this meeting. So I'll move on to what happened at the end of the negotiation process. The zero draft was published in May this year. It was then a closed member state negotiation process. However, we did manage to get hold of drafts at each revision and undertake analysis and send out advocacy messages directly to governments and to advocates. But at the end, finally, when the document came out in September, what did we get? Well, first of all, given that we came into this asking for accelerated action on NCDs and addressing this implementation deficit, we were really pleased to see a set of targets really shaping the declaration. And we felt that really showed that governments, whatever the other weaknesses we might point out, that governments were recognising that we needed accelerated action. So there were these 3 fast-track targets of 150 million fewer tobacco users, 150 million more people with their hypertension under control, and 150 million more people with access to mental health care by 2030. These were, big tracer targets. Could they have been bigger? Well, possibly, yeah, probably, yes. Many argue they should have been, but they at least showed this commitment. And then there was also a set of targets for each of the main chapters of the declaration. There was access, two that we were particularly pleased to see was commitments on access to medicines, affordable medicines. The target was 80% of primary healthcare facilities in all countries have availability of WHO recommended essential medicines and basic technologies for NCDs and mental health at affordable prices. And there was also a commitment of 60% of countries with policies to limit, with financial protection policies to limit out-of-pocket costs. And we thought these were really important commitments. There's a QR code on these slides for our full response to the high-level meeting declaration, if you want to see it. On the downside, we saw a real weakening on, particularly on issues around prevention. In the original draft, there'd been a target for 80% of countries, increasing health taxes on tobacco, alcohol, and sugar-sweetened beverages. By the time we got to the final version, this was completely gone in favour of a much vaguer target on adoption of policies, legislative, regulatory, or fiscal measures to support health objectives, which could mean anything. Commercial determinants, we could not get that language into the text. There was inconsistent reflection on management of conflicts of interest in health policy. There were no new investment targets or commitments to scale up resources. Accountability mechanisms for these targets were not really spoken about. So there's nothing on that process. Civil society only got mentioned once, which was really concerning, although there was better language than previously on the importance of lived experience in policy development and delivery. So yeah, an equity and rights framing also got somewhat softened and diluted during the process. So that was the declaration. At the high-level meeting itself, what did we get? Well, it was great. A great number of governments showed up. Over 90 of them sought the floor to make statements during the day of meetings. They expressed an understanding of the severity of the NCD crisis. Many of them were keen to show that their efforts and successes at the country level. But there were those who, wanted to make an issue of it. I'll come to those. For example, Italy and the US specifically opposed health taxes. Some of the member states were pushing back on how we frame alcohol, constantly using this phrase of harmful use of alcohol, not wanting to put it in the same bucket as tobacco, and some of the usual suspects pushing back on language around gender. So yeah, that's just some stats on the type of things that the government's wanted to make statements on. But the big news, and I think the one that grabbed the headlines, was what the US did at the meeting. They said that they were stepping away from it. They felt that consensus had not been reached, and therefore the declaration should not have been presented. And the Secretary of State himself, Robert Kennedy Jr., was there at the meeting and made this statement. So let me just explain what that was all about. Normally speaking, for a political declaration from a high-level summit, there are 3 steps. The consensus is said to be established through what's called a silence procedure at the end of negotiations. If nobody breaks the silence, consensus is said to have been reached. That agreement of the declaration is then announced at the high-level meeting itself by the chair, usually the President of the General Assembly, the PGA. And then subsequent to that, usually as a formality, it's adopted by resolution at the UN General Assembly in the weeks following the high-level meeting. What happened here on the 25th of September is the US said they had not agreed the political declaration. They had not joined the consensus prior to the high-level meeting, and therefore it should not have been presented. The PGA on the day said that she had heard the concerns raised, but recognised also the broad support voiced by the member states at the high-level meeting for the declaration, and that she would pass it on to the UN General Assembly. So it was a bit of a mixed outcome, but it was clear that it was being progressed on. But then we waited all through October, and we waited all through November. And it felt like Christmas was coming and we were still waiting. So finally, last week, we heard movements. We had been acting behind the scenes and contacting governments, asking them to continue to voice their support, continue to ask the PGA to bring the declaration forward. And we were very happy that we finally heard at the end of the last week that it was going to happen on Monday of this week. And so at 8:30 UK time yesterday evening, the agenda item finally came up, and I was watching last night. I don't know if any of you were. And sure enough, the US delegate again voiced their opposition to it being brought forward, again saying that they hadn't given it their consensus, and had used a rule of procedure to call for a vote on objecting to the resolution being brought forward. On that vote, 3 voted with the US. That was the US, Argentina, and Israel. But the overwhelming majority voted against this objection. And then there were 5 abstentions, and there were some interesting names amongst that, including some small island developing states like Fiji and Tonga, which is quite concerning to see, and questions to be asked about what was happening there. And in the vote itself, as I said at the beginning, the vast majority went with the declaration, even including some of those who had voted had not voted in the previous round. The 2 against were obviously the US, and in this case Argentina, and the abstention was Paraguay. So let me keep going. So the overall impact, what impact did that bring us? This was, again, the impact question. What does it do to help? Well, we definitely feel like it's secured political visibility this year. We've had a great deal more coverage than we had in previous year. We've had more governments answering our calls when we've wanted to talk to them this year, because they've had to engage with this UN process. It's established measurable global and tracer targets, which are giving us this new benchmark for accountability. But it has exposed some fault lines in global health politics across the prevention issues, financing issues, and industry regulation were deeply contested during the negotiations. And we were certainly aware throughout, and from very early in the year, of health harming industry advocacy in New York and in capitals, really resisting things like fiscal measures and taxes or naming of commercial determinants of health. And we could really see how the likes of alcohol and big food are nervous about growing momentum on regulation. But we feel like it's re-energized the global conversation. It's brought governments, WHO, and civil society together under a framework ahead of the 2030 process. And it's certainly strengthened some global level advocacy with engagement both in national missions and in capitals. So yeah, we feel like, you know, our piece about building the noise and stronger and more coordinated civil society movements, this has really given us a platform for that. And our campaign, our Global Week for Action campaign, has had an incredibly successful year. I won't read through all these figures, but yeah, 16 million people reached through the hashtags and a whole range of really good engagement with our content, plus very good media visibility. In the high-level meeting week itself, we had two pieces in the New York, well, two pieces, we had two quotes in the New York Times that week in coverage of the issues. And our Call to Lead campaign, our sign-on level letter, has got sign-ons by over 600 organisations and 15,000 individuals. And this was, you know, these organisations represent over 3 million members worldwide at a conservative guess. So very pleased to see that. So finally, beyond the high-level meeting, what comes next, having gone through all that? Well, first of all, it's on the one hand, for the NCD policy agenda, it's all about implementation and accountability. So you will see us this year through the WHO process looking for updating of the global monitoring framework to incorporate these targets and seeing that progress that's developed. There's going to be new developments on the best buys. And we'll be really, like I say, working on national and global advocacy for implementation. So what we say many times is, for those targets and those commitments, they are the floor and not the ceiling for what we want to see happen on in terms of NCDs and mental health action. But so on the one hand, implementation and accountability. Also, investment is still a key point. Wanting to see the financing dialogue that's happening in September of this year being a big moment, and the global health and development agenda. And I know I'm running out of time, so I'm just going to give two more slides because I just want to really flag these last two bits. Looking beyond the high-level meeting, that we all know things are changing really fundamentally in global health. Since the 20th of January, US withdrawing from WHO, the big cuts they have made to their financing and general cuts in other government budgets, there's a real shift. So we're expecting big discussions to carry on and really develop. WHO has undergone significant cuts and restructuring. The UN 80 initiative is looking at ways to streamline and restructure the UN mechanisms. The America is continuing with its America First global health strategy with bilateral rather than multilateral approaches. And, you know, recipient governments and lower middle income countries are responding. For example, the ACRA reset from the African nations, responding to this position. The EU, for example, has also undergone its own process in terms of relooking at global health and its contribution. FCDO is doing something similar. And there's others leading their own dialogues, and there's a great, including the Wellcome Trust is running some multi-sectoral dialogues, and there's a great deal of commentary on it. So the last thing I would say is, if you are interested in these issues, please engage with the Health Architecture Reimagined CSOs initiative. We're running regional consultations. We'll be sending out a survey to look for civil society views, civil society views on the global health systems, and bringing out our own report on that. So yeah, we think these global health systems really matter. We've been through our own process this year, and we really are looking for your engagement in this. So this is just my last plea. So yeah, sorry, I have taken quite a long time. I hope I have still left you with enough time to answer some questions. Thank you.
Alison, that's great. I hope people are putting comments and questions in the chat column. In many ways, it felt, especially at the beginning, you were tracing the history of C3. So a lot of long ago memories from my point of view, including the 2011 high level meeting. We've a really significant, large and important group of participants. I mentioned before that we're joined by Ben Sims in partnership with us, Global Health Partnerships. But I was also delighted to see that Carrie Adams from International Cancer, one of the 4 founding organisations that you mentioned right at the beginning. So please either raise your hand or put comments into the chat, and we can bring people in to so I'm going from the bottom, which is not the right way to do it, but there's a very long question. Who doesn't want to speak? Let's keep going. There's a lot of people's AI crowding in the chat.
I think I see a
So
hand
Glenn,
raised.
yeah, indeed, Glenn Stewart, who's a long-time friend of C3 from North London. Glenn, introduce yourself and please ask the question. You'll need to unmute. Glenn Stewart, can you? So I'm not sure if Glenn is stuck or we're stuck. Katie Cooper's asked a 2-pronged question. Katie, you go for it and we'll see if the system's all right.
I'm back on if that helps.
Ah, brilliant. Okay, go for it, Glenn.
Hi. So I mean, it's a good point you said about, sorry, I'm a consultant in public health in North London. So the exam question, I think you answered that really well. That's really helpful, thanks. But I suppose, well, yeah, the real question is like, can we do something about rising prevalence of NCDs or reduce their prevalence? And I mean, the obvious answer to that is obviously we can. So Sevi Dak, the professor in Edinburgh, the professor of public health, who's like writes very good stuff. You know, so each country can learn from the other. So like she talks about the rest of the world learning from the UK about smoking and from the Netherlands about physical activity. So obviously we can do something about like NCDs. I suppose the issue is like, how do we do it? And it always strikes me that the UN is a necessary but not sufficient component of that. And what really worries me is commercial deployments of health, is what you're saying in there, and also misinformation, disinformation. And I'm just wondering how you sort of reconcile that. Like, it seems to me there seems to be a sort of tide going in one way, and we're trying to go the other. How's that for a rambling question?
Yeah, thanks, Glenn. Yeah, so I think, yeah, your point is a good one, that there's, and I think that's what we're trying to say. We know what to do. There's plenty of evidence-based interventions, particularly on the prevention and health promoting side, and indeed on the care side. So yeah, what is it that's stopping us from doing it? And I think there's a range of issues there. I mean, certainly there's one about, obviously building political will, across all the things they need to do. Why would governments do specific one, take on a specific initiative? So you need good advocacy to show that there's support for this, because we know we are up against strong resisting forces from particularly what we call the health harming industries. Across tobacco, alcohol, and those producing ultra processed food, the big food. And it's not in their interest to see regulation and taxes on these products, but we know these are really effective measures. So we need more progress on managing conflict of interest at the national level and at the global level. It's really noticeable in New York. the access that they have. It's not like tobacco. There's no need for transparency or recording the meetings that are had with health harming industry lobbyists. And there's a real need for better management of that, of putting, public health as a primary interest versus what's being pushed by specific companies who are externalizing their costs. Money is obviously the other issue. We keep saying how low cost they are, high return these interventions are. So it's trying to get that support for these measures onto the political agenda, so we can learn not only in how across countries, not only how governments deliver, but also how we get them adopted in the first place. What campaigns work, what arguments work, what coalitions of interest work. So I hope that's a start to an answer.
Thank you.
Certainly is.
Kate's unmuted now, if that helps.
Yeah.
Thank you. Sorry we muted people longer than we should have. Katie, particularly the second half, I think, of your question would be.
Yeah, thank you. First of all, hi, Alison, and hooray for the political declaration finally being passed. This is excellent news. So great to hear that. Yes, my two-pronged question neither half will surprise you, Alison, but just would like to hear your views on this. Christian says the first half may be less important, but how will the post-SDG framework be negotiated? Because obviously that's going to be coming up very soon. But also, this is more from sort of the UK working group on NCD's perspective. How do we keep this pressure on our governments? Because as you'll know, and some on this call will know, we've been talking regularly to FCDO throughout this year, ahead of the high-level meeting, because they have to engage. It's one of these big moments in global health. But once that moment is gone, it's much harder to keep them engaged. Really doesn't help that FCDO is losing about a third of its London-based staff. But what would your recommendations be on keeping that pressure up and keeping those conversations going when governments have so much to worry about at the moment, and NCDs really, they've been a priority in 2025, but how do we keep them on the agenda?
And for people not familiar with UK three acronyms, FCDO is the UK's Foreign Office, in which is embedded our International Aid Department. Anyway, over to you, Alison, to carry. Thanks, Katie.
Yeah, thanks. So yeah, two huge questions. On the first is about what's the process going to be. I mean, the first thing to say is we don't know exactly yet, and it probably won't officially start for another couple of years. I think there's some hesitancy about starting renegotiating the post-SDG goals for fear that it would look like they have failed if we need to start negotiating them so early. So I understand there's some sensitivity around that. But as I was saying, there's a great deal going on right now in terms of people saying, well, how do we respond to this financial crisis? And also, the sort of challenge to WHO that's coming from the US. So there's going to be discussions going on. We're aware of it happening in different places. There'll be a paper going to the WHO's executive board in February, specifically on how WHO is responding to all this, the UN80, the cuts, and these dialogues on what's being called global health architecture. So I think the first thing to do is for us as civil society to try and follow these processes. And it's tricky, and that's why I do really recommend engaging with Here's CSO, getting on their newsletter, having a look at their website, answering their survey, as a place where we're hoping, as a group, as a consortium, we can keep engaged civil society and keep the conversation going. So watch this space a bit. And then what can we do? Incredibly difficult. But I would say the UK government was one of the first to take the floor yesterday after the vote of adoption. So it was really good to see the UK continuing to engage, at least for 10 minutes after the political declaration was adopted. But I think we have to keep making the case of why NCDs needs to be part of this bigger picture for, on the one hand, implementation, on the other hand, integration.
So can I invite Emma to ask her question, and then Antonia, and then Alistair, who put his hands up. Emma, your question on interesting on ILO.
Good morning. Thank you for this. I was just interested if there is anything, a collaboration with the ILO and WHO. We talked about the commercial determinants of health, but largely the workplace does influence NCDs through low control, all the workplace conditions. And it also leads to adopting unhealthy behaviours to cope with that. So pushing people back into work, it has to be good work. And the workplace was identified as a key setting in determinants of health. So prevention, health promotion, ill health, health protection. So just wondering if, listening to everything from the health perspective, you said bringing everybody together to talk about it. Was there any discussion with as the workplace as being a key stakeholder?
Do you want to collect questions? Or
why don't we take the last three and then you can bundle them together? So Antonia, can you ask yours, and then Alistair ask his? And I will also point out a very long question in the chat on women internally displaced due to conflict. That's a very long one. So Antonia, and then Alistair.
Yes, I was interested in the point you made about the implementation deficit. So what do you think, looking from where we are now and going forward, what do you think will be the most important and valuable things that could be done differently or with renewed impetus? What will make the biggest difference compared to what's gone before in addressing that implementation deficit?
Yeah.
Alistair, last word. If you're able to unmute, maybe you've left. Okay, Alison, over to you, I think.
Okay. Well, on that one about the ILO, it's a really good point, and the workplace is incredibly important, and what employers can do. We often get called out for going on about industry. We really do mean health harming industry. There's a great deal across the private sector and industry as employers could be doing, and as a key role in promoting health, and do need to be recruited and brought on side. Unfortunately, I don't know enough about what goes on between WHO and ILO. That might make a really good future C3 piece. But I would flag up, coming up on the agenda this year is a WHO piece on the economics of health for all, which is really about putting health as a primary consideration and centralising it within government and within the economy. And I think that's really one to watch, how that report is debated and adopted. On the implementation deficit and what would make the biggest difference, it's if you look at things like the Best Buys, they do lay out a good range of interventions. Obviously, one I always go to is the one on health taxes. They're the most efficient and cost efficient, and we're way off optimizing where we could be in terms of recommended levels of taxation, in terms of cost price, both on tobacco and we could see much higher taxes on alcohol and sugar-sweetened beverages and other unhealthy foods. And these would also, as well as being effective prevention mechanisms, bring in revenues for governments, which they could potentially then apply to their health budgets. So that's one you will see us champion often. But there's also a great deal to be done, I think, in terms of getting more drugs to more people who need them on that care side of things. So we were really pleased to see this piece around access to affordable medicines and to financial protection mechanisms to save people from out-of-pocket costs on NCDs. These are really key parts of the challenge, and I think making progress on those this year, in the coming year, will be really important. So you'll see a lot about access to medicines on the road to the financing dialogue in the Philippines in September. So with not much time available, that's what I would say on those. On the piece, I appreciate the question about displaced women, that there are all sorts of marginalised communities, you know, women in rural settings generally, and village life and so on, where there's all sorts of challenges. And we know that you know, for the people in these marginalised groups, these have the highest risks and burdens from NCDs in the long run. So it's really important that community-based action is part of how we deliver NCD prevention and care, and the voices of people with lived experience is absolutely central to the way policy should be developed and delivered, and that's key to the way NCD Alliance frames and goes about its work. I'm not sure that I'm asking
Alison,
that well, but that's the best I can do.
The clock is marching on as well.
Yeah.
I think your phrase about implementation deficit, I think, is a really powerful one to take away. Been a brilliant resume, but also lots of interesting ideas and challenges on the way forward. Really helps setting C3 agenda. I'm sure global health partnerships will also see this as an important area for global health generally, not just in our own countries. Very grateful to you for such a brilliant and clear, your slides will be very useful for a long time afterwards, I think. My thanks to Global Health Partnerships for being good partners with us during the 2025 season. We will in the spring be announcing our 2026 season of international seminars. In the meantime, happy Christmas to those who recognise Christmas, perhaps particularly a peaceful Hanukkah at this season, and happy and hopefully a more peaceful new year for everybody. Thank you so much for joining C3's International Seminar, and a very big thank you, Alison, for such a very clear and really important and very, very well timed seminar. So thank you, everybody, and goodbye.
Thank you.